Hi friends, now I want to come to you with a video today and I want to talk to you about a much asked topic. And I've been getting messages from students for last 2 months to make a video on next. But only thing I was waiting was because I wanted to make sure that we wanted to see how the things are flowing. It was in the draft bill stage, then it became an act, and we wanted to be sure on it before we talk about it. Now we all know right now that there is a bill called as NMC Act here, and there is something called as next exam, which is being planned for medical graduates. And this is going to be a single window exam for people who are passing the MBBS for their license, as well as for their PG entrance, as well as for the foreign medical graduates appearing for India who want to get a license to practice in India. And this would replace the NEET PG in due course. So I thought, there are some myths being circulated. I thought let's just, at least give an idea on students to the students that what is to be done at this moment. Now, if you are a student in current year, I hope you are aware of it that it will take time. The government has drawn a timeline that once they constitute the National Medical Commission, within 3 years they will bring up this exam. So you know that this year you are going to appear for NEET exam only. There is no change here. So do not get so confused. The first and foremost reason for me doing a video today is to reassure you that current year students, you are appearing for the NEET exam. Let's not have that confusion going on. Is it changing this year? It would take time. And there will be a batch who would have to appear for the next exam. And what are the major implications for those batches? I want you to know them, and these are more relevant for people who are doing currently they are pursuing MBBS. Now, if you are pursuing MBBS right now, these are the things to keep in mind, that there will be a batch in the coming years where they will have to face an exam at the end of their final year, not at the end of internship like you do usually. So the foremost thing you should that you are getting 12 months less than a usual batch for a PG entrance preparation. And then ultimately all other batches who would come after that, they get used to it. The challenge is in the batch which gets hit by the exam first. So I would ask all the students to assume that maybe we are going to be the first batch who will appear for the next exam, and you start preparing in the MBBS itself a bit earlier. When I say bit earlier, what do I mean? I mean that today the majority of the students, they start thinking of PG entrance or the NEET exam in their sixth semester, and that is the norm. And there is a smaller chunk that starts thinking in second prof. I believe that the third or fourth semester, which is your second prof, would become the new sixth semester now, because you have to prepone your preparation by a year or so that you hit the exam with the same level of preparation like you would have hit the exam at the end of internship. So starting early is a big message that I want you to have. Starting early is a key thing. Second is that we need to know that whenever the exam patterns have changed in the past, the style of asking a question usually changes, and the people who were doing rote learning based on guidebooks, and you every time those guidebooks, people who have written those guidebooks would appear like gods to you, but the change in exam pattern would shatter their godhood, because it's very important to understand that the concepts are become the king when it is having when there is some change happening. Let me explain to you. Now, suppose you understand how kidney develops or how the horseshoe kidney is, you are able to do questions whatever may be the style of asking in the exam. However, if you rote learn a previous MCQ, you get hit by the change in the exam pattern. So my two big messages to you are, number one is we need to start early. That is very, very important. Looking at the current scheme, I would start early. I would say that people who are now looking at sixth semester as a starting point, probably you will see in future it would be a little early to start preparing. Second thing I want you to know is, do not go after rote learning. Do not go after the traditional standard that this is the guidebook, this is the guidebook. Don't get into the guidebook thing. Stick to understanding the disease process. And this entire thing that I'm telling you is also highlighted in the new MCI curriculum. I hope you know in 2018 MCI came up with a new curriculum which is all based on things like practicals, competency based learning, And it is also based on horizontal and vertical integration, which I will explain to you in due course. I'll talk about this in this video as well. But you need to know that what I'm saying is not only my process, it is the thought process of the even the entire medical education shift that is happening in the country. It is to change the rote learning method in MBBS to more competency based learning, and that is the vision of the entire education system in the future as well. That means in future when you will be in your first prof, and even in year onwards, probably you are in first prof, you will have some inputs from orthopedics when you're studying bones and anatomy, or when you're studying cardiovascular system, you will have to do some horizontal integration with the cardiac anatomy and cardiac physiology, and vertical integration with the medicine faculty. So that would become the norm in the exam as well. So next would have two parts. It would have a theory which is objective based and a practical exam. You have to pass both of them to get the license. And then the in your theory exam would be counted as the marks for your PG entrance exam. So you have to kind of prepare for both, and you have to take both the components in the seriousness, because to get the license to practice medicine you need to pass it, and for PG entrance you need to score better than others. In effect, the next would be my exam, which is both qualifying as well as discriminatory. Qualifying means that you have to get the minimum number of marks to get a license to practice. Then you should be able to do those discriminatory questions you need to solve, so that you can become a better ranker, so that you can choose better institutes or better subjects, whichever you want to do. You get more choices for you available at top of the ranks. That is where the paper would also, I believe, in future would have that balance. There will be some average difficulty level questions, some qualifying level questions, some discriminatory level questions, which will be required to understand who is going to get into the topmost institute, because that becomes the single exam that everybody has to give for all purposes. Next is going to be for the foreign graduates who are trying to get into the license for practicing in India. Next will be for the licensing for all Indian graduates as well as it would serve as a window for PG entrance exam also. So that exam becomes very important for you in future. And already at that we are working full time, trying to adapt to every change. And in the last 2 decades we have adapted to any change better than anybody else. Every time there were changes. When they introduced computer based tests, we started doing computer based exams in our own centers. Now we do 4 computer based tests every year. Now when the visuals first started to come, we were the first people who actually started teaching in visual manner, video manners. We've been able to predict every change well in advance. So reason is that we always believe in core competency learning. We believe in conceptual learning. I strongly discourage any guidebook based study, because guidebooks or pre-recorded lectures, they usually not help you learn the concept. They are trying to induce that you listen to this rote learning thing and you finish it off. I don't believe in rote learning here. I believe in understanding. Understanding happens when you participate in a learning activity which is more interactive, where you are able to ask, answer, discuss. More interactive learning would be the key, because practicals would also play a role in your passing in the exam and getting a license to practice. So already we have a ophthalmology practical running in the eMedicos app, and soon we would be doing much more things. Things are planned under in DAMS. Every day we are looking at a lot of activities we are doing, and a surgery practical course is now launched in the eMedicos app, where we have actually created actual patient videos, so that people learning with us have that edge to appear for the practical exam as well. Now, the key things are, I want you to take these messages home, that the medical education will now become more and more competency based. The rote learning mechanism of those guidebooks and MCQs, don't buy them. Don't get 19 books that you're buying and getting into in the MBBS beginning itself. Try to focus on learning the disease. And this is the key that I want you to understand. Now, this is what the future exams would have. You need to understand the integration between the clinical and basic sciences within the same discipline. Like I told you, when you integrate cardiac anatomy with cardiac physiology, that becomes horizontal integration. When you integrate cardiology with the disease and with the pathological part, those pathology, and with the medicine part of it, with the cardiac surgery part of it, that becomes the vertical integration. Gradually, what will happen is that the questions would stop having a definition on which subject they belong to. They will have more and more integration in, and these questions would be more likely in the papers which are going in the part of the paper which is more discriminatory. So that is my rationale of believing that people should start early so that they can form a strong foundation in the basic sciences, so that when they come to clinics they already know how to integrate it. And that kind of learning is the kind of learning that we're known for. If you scroll through YouTube, you'll see that for last 5 years we've been putting integrated videos. We've been putting things where teachers are sitting together talking about pathology, radiology in one go, or we are talking, we keep trying to integrate things. That is our philosophy in dams as well. So I strongly believe in it, and this is the vision of the government of India for future of medical education as well. So we are looking at such kind of thought process for you also, that this is what you are looking to prepare for next exam. These should be your goals. And for the people who are already in final year or third year and they are thinking, what should you do? You have to audit what you have done so far, and so that you can plug in the gaps. My suggestion is, do not take it lightly. When they say it will be in within 3 years, within has some gap in between. They have left a gap to, within means 3 also, within means 2 also. There's some gap in that language that the government is saying. So I would always advise students not to take it lightly. Imagine that maybe if my exam comes in beginning of internship, am I prepared enough? Do not ignore any subject, because you need to be thorough in horizontal and vertical integration, and you need to qualify the exam bare minimum, because if you don't qualify, you don't practice medicine. So you need to be qualified in it. And my message to all foreign graduates also will be that every year we get foreign graduates visiting us during their vacations. And now when you come to us this time, we will also have, in the coming years, we'll have mechanisms to help you with the practicals also, because I feel both of them would be important. But for PG entrance, only theory marks will be considered. So keep all these things in mind. Keep in mind that you have to become more alert, because sometimes I see when you are in third year in dams, you are taking it a little easy, that you have time. I would suggest, let's take it in a little bit of a hustle mode, that what if the exam comes early? Am I prepared enough? And push the pedal a little harder. That is what is required. That is the need of the hour. Because many students were writing to me, I thought, maybe I can address this in a generic manner video, and I'll, anyhow, I love talking to students. I'll come to your center, talk to you. But I hope I've given you an overview on how the scenario would evolve in due course. And if I, summarize the key messages, my key messages for you would be these. You need to start earlier. That is the key here. Earlier, we were looking at, predominant number of students joining at, semester. I would now say start early, because the exam might come one year early. The most logical conclusion is, let's start early. Let's go faster. Do not forget the concept of integration. Integrated learning would mean horizontal as well as vertical. Do not ignore basic sciences as of now. There's no point in doing that. You need to know integration. Do not go after pre-recorded material or guidebooks and question banks. They may look like Bibles to older students, but for you, I would believe, let's go towards the disease process. Once you understand what is rheumatoid arthritis, what is rheumatic fever, you know the game. You know the game, and you are able to apply it to in a question irrespective of the question. But once you are mugging it up from a question that, okay, 2000 it was this, 2002 the question was this, then you struggle. I firmly believe it in right now also. Even if there is, even if I forget the concept of next, even for NEET, there is no point in going about rote learning. Rote learning doesn't work out. You need to build concepts. And to build concepts, my belief is, do not ignore the traditional classroom based learning, where your teacher is talking, you interacting, do interact in a classroom. That is my suggestion. I tell this to all my students every time you come to a classroom. I say, let us start by speaking in the class, answering in the class. Let's understand. Let's go towards understanding. Understanding is always the key. Understanding means that when I understand a concept, it goes into my subconscious as understanding rather than going into my hippocampus as a memory. Memories are forgotten, understanding stays longer. And second is understanding is immune to any kind of pattern change. Memory is, can be affected. You know this, if you're rote learning it, you do not know what it is, you struggle if the exam pattern has a different way of asking a question. But once you understand a concept, that works. So on part of dams, I would like to say here is that we are looking at every change possible, and you have to believe that we are working on it. You can see with the speed which we have created some practical courses for you which are already live on eMedico. We are working on it full time. And second is that we believe in conceptual learning, building concepts. We are there. I can assure each one of you that I am there. Anything that changes, I'm here to assure all my foundation students, also the third year students, second years who are with us in different courses, don't worry about it. Anything that will change, as soon as they release out a sample test paper, you will see we would be the first people to help you practice that. Don't worry about that. We will be there. We are there with you today. We are there with you tomorrow. We are looking at the system. You are in good hands. I just want you to say, keep learning, keep understanding, keep enjoying learning. When you remain a learner, when you become a learner, you understand that you're not looking at an exam, you're looking at a way of learning medicine. When you're learning it, you're enjoying it, it doesn't matter what exam is this. So let's stay positive about it. I'm there to help you, I'm there to work on it, and we will work on every aspect of the exam with all our heart, all our energies, and all our synergies. By synergy, I mean is that DAMS is an organization where we have so many teachers who we come together, we discuss things, which is unlike any other organization today in India, where we have people who are talking to each other about the subject. We talk about it. Like when I talk to you about investigation of choice in radiology, I've already talked with the surgery faculty, with the gynae faculty, with the medicine faculty, and I understand what their textbooks are saying, what my textbooks are saying. We try to integrate. We do it every day, every single day of our lives. Every time we meet, we talk about medicine. We love medicine, we love teaching, and we love changes. We love changes. I'm telling you, any change that will come, you will find me adapting to it. I work on it all the day, and we have done it in last 20 years many times. So I'm here to say only one thing. I'm there. Have faith and keep studying hard, keep understanding the concept. The students who are in appearing for the exam this year, next is not coming for you right now. Keep studying, don't worry, I'm there. I wish you all the best. I'm sure you all will rock. The names of the exam will change, but the medicine will never change. Have faith. Best of luck.